We're definitely not number one when it comes to healthcare. So actually the U.S. healthcare system was ranked dead last when compared to other developed nations. So it's the worst in efficiency, equity, and outcomes when compared to others. So take a look at the graphic here. So these are other developed nations, including France, Australia, Germany, Canada, Sweden, so all the developed countries. And you can see that on average, we spend about $8,500 per capita on healthcare. So you would think that for that amount of money, we'd probably get some pretty good outcomes, but it turns out we are not. We're absolutely the worst.
Okay, yeah, that doesn't sound quite as good as we're number one. We're dead last. Okay, doesn't have quite the same ring, but we are, to be fair, Lizette, we are number one in how much we spend.
Exactly.
We're dead last in results, but we're number one in how much we spend. One of the things in the report, it says, it was surprising that the high rate of expenditure for insurance was not commensurate with the satisfaction of patients or the quality of service. You don't say. Well, we live that every day, so we know it. But we're told, no, just leave it to the free market. If you're paying more for insurance, that must mean you're getting great service. That's why we're number one. No.
Absolutely
Unfortunately,
not.
it's the exact opposite.
Exactly, and the report actually points out that the key difference between us and other industrialized countries is that we lack universal health care. That was the main differentiating factor that contributed to these terrible outcomes.
We were also bad in quality of care, access to doctors, also in efficiency, equity, and outcomes.
Yay!
Yay us! You might want to change that system a little bit. Now, of course, now they're beginning to change it. They're saying that some of the developments are positive because now we're covering more people, but we still got a long way to go.
What's interesting, though, too, is that when you look at what we are good at, it tends to be on that which focuses on either academics or pharmaceuticals. So we're the leaders in like cancer treatment and research and other areas of research in pharmaceuticals. And I mean, I think profit is definitely something to be considered here, and that we care more.
You think? Pharmaceutical companies are doing it out of goodness of their hearts.
Why is it that in this area, right, we have this incredibly strong focus on research and development and understanding the drugs to help people, but we don't focus at all on the outcomes. You know, we put profit over health, and that's, I think, a systemic issue that needs to be addressed in these studies that it is just not covered.
So a lot of times we have the discussion and people say, hey, we're drug companies, they make money by actually saving people's lives. So they create these amazing things. That's why we're leading in that category. But if you look at it overall, obviously the profit motive is higher because the results in the overall picture are disastrous. I mean, we're number 11 out of 11 wealthy nations that they looked at. But if you look at all the nations, including ones that are not wealthy, we're number 37 according to the UN in outcome for healthcare. By the way, who's number one in this study? UK, which is what the conservatives say. You want to be socialist like the UK with their terrible medical system? No, they're number one. Number two is Switzerland. They're socialist in Europe. Yeah, that system is better. Look, it's a lot of propaganda. That propaganda brought to you by marketing, paid for by insurance companies, pharmaceutical companies, and the politicians that they have paid significant money to. So that's why we have the worst system, and it costs us the most amount of money. Because the system was designed by the people who make that money, not the people who are getting the insurance. Anybody know how to solve that? Do I hear wolf-pack.com?